Brooklyn Independent Television.
You've bought a fancy new mattress, stopped drinking coffee past noon, and tried reading appliance manuals right before bedtime. But nothing seems to help you fall asleep. Healthbeat Sherry Carabin takes us where you may want to go, to the lab.
I'm having great difficulty sleeping. I can't sleep, and when I do sleep, I'm always tossing and turning to get comfortable.
The symptoms may sound familiar to a lot of us, but for 58-year-old Ashley Murray, the inability to get a good night's sleep has become a way of life, and it's having a negative impact.
I can't sleep, but I fall asleep during the day.
First thing I'm going to ask you to do is put these 2 wires down your shirt and down your shorts until it hits your ankle area, and I'm going to give you 2 more for the other side.
So on this night, the former Brooklyn resident decided to take the first step toward doing something about it by undergoing a sleep study at United Sleep Diagnostics on 4th Avenue in Bay Ridge.
I just need to find out what's going on with me. Is there anything wrong with me?
There are different types of insomnia, which by definition is inability to get to sleep or stay asleep.
Dr. Gerard Lombardo is a sleep disorders specialist at United Sleep Diagnostics.
If you do a national poll, you can get a number between 7 and 8 hours that we think is a good amount of sleep for the average person. Many people complain about, I can't get to sleep, but then they get up the next day and they're fine, they're productive. We look more to quality of life as defining a disorder. So that's inability to get to sleep, stay asleep, where there's an impact on one's quality of life. That being focus, lethargy, not feeling productive, things like that.
Do you mind removing the glasses for me?
Oh.
Thank you.
We categorize them in terms of acuteness. That is, if there's a life event, we all experience sometimes a sadness, loss of a family member, a stress, a personal stress. Then we have an acute insomnia, which is defined by weeks, as opposed to a chronic insomnia.
Is one type of insomnia easier to treat than another?
Well, chronic insomnia is difficult to cure. The insomniac learns how to drink coffee, for example, to counter the feeling of tiredness from the poor sleep. That coffee then interferes with sleep. They take naps here and there, again disrupting the natural rhythm. The naps create insomnia, so insomnia begets more insomnia, and that goes on over the years, and they learn how to live with it, but most are not happy.
One of the most important factors ensuring a good night's sleep is consistency, which is why many shift workers have problems.
We need regularity to sleep well, regularly, and to sleep with the restorative benefits.
There are ways to treat insomnia. One of the most common is cognitive behavioral therapy.
I think more and more sleep doctors are depending less on medication, pills, understanding that the pills can only do so much, and you get more out of changing behavior, helping them unlearn negative thoughts and incorrect beliefs about sleep. And the cognitive training, behavioral therapies are very successful for that.
Lombardo also uses guided imagery techniques to relax patients and help them fall asleep. I have problems with insomnia, so I decided to give it a try.
All right, so what you do is you create the scene, and you're going to walk through it yourself. Your eyes are closed. Again, you're going to be using this technique as you go and approach your sleep time. So you'd be in the bed relaxing, and you're going to bring yourself to that very calm place. So picture in your mind, it's a warm summer's day and you're heading for the beach.
Patients should not expect these exercises or other types of therapy to work overnight.
How long does it take, on average, if you were going to treat someone?
An average of 4 months, for example, for a chronic insomnia.
Like many who suffer from insomnia, Murray has other problems that are complicating his condition.
And I think there are 3 sleep disorders operating to contribute to his excessive daytime sleepiness. He was actually sleeping in the waiting room. Insomnia, restless leg syndrome, again by the history given, and sleep apnea as I examined him.
Sleep apnea can lead to more serious problems. Insomnia is not to be taken lightly either.
We have over 1,500 deaths on the highway. And we've heard recently in the news some very disturbing stories about accidents.
And I'm willing to take medication. If it's a matter of diet, I'm willing to have a diet, change what I'm eating. Whatever the doctor can recommend that will help make me be able to sleep through the night without tossing and turning, or falling asleep without having to wait 2, 3, 4 hours, and just be able to have a good night's sleep. I'm willing to do whatever the doctor recommends.
Reporting for Healthbeat Brooklyn, I'm Sherry Carabin.
Follow us on Twitter at BK Independent TV.